The Emperor's made a critical error and the time for our attack has come. The data brought to us by the Bothan spies pinpoint the exact location of the Emperor's new battle station. We also know that the weapon systems of this Death Star are not yet operational. With the Imperial fleet spread throughout the galaxy in a vain effort to engage us, it is relatively unprotected. But most important of all, we've learned that the Emperor himself is personally overseeing the final stages of the construction of this Death Star.
Hello, Stormtroopers. This is Trooper Elizabeth, and today I will be walking you through the infectious disease meningitis. It is important we learn about this infectious disease as of one of many that we will be learning about, because we are about to embark on a mission to planet Earth in order to obtain materials to construct the Death Star. Your mission is to conquer planet Earth, and it's your job to learn all about the potential threats, especially the ones we cannot see with our own eyes. This infectious disease in particular targets the brain, and in particular, again, the meninges. The meninges are 3 layers outside that make up the outside of the brain. The first is the dura mater, which is a thick, durable layer that is closest to the skull. The next layer is the arachnoid layer, which is the middle of the meninges, and its job is to cushion and protect the brain, and it resembles spider-like webs. The last layer of the meninges is the pia mater. It's very thin, delicate membrane, and it follows the contours of the brain. As you can see in the top image, the meninges are outlined in comparison to their location next to the brain. Now, what is this meningitis that I have spoken of? We know as stormtroopers that there are certain things on Earth that we cannot see, such as bacteria. In this case, meningitis is caused by a gram-negative diplococcus. It's classified into groups based off of its outside capsule, which is made up of something called polysaccharides. And this bacteria can be grouped based off of the different composition of that polysaccharide capsule. And so we are used to fighting Jedi, and this threat is very different. This threat can enter without us even knowing. So the bacteria will colonize most often in the nose or the throat and move throughout the body into the bloodstream. From there, it will enter the subarachnoid space and cross into something called the cerebrospinal fluid. And this cerebrospinal fluid provides nutrients for survival and multiplication of the bacteria. And within the cerebrospinal fluid, there are very minimal antibodies that protect us against pathogens like this. And there is very few immune cells, which allows for the bacteria to survive and proliferate. Here are 2 images for us to see. On the left, we see how the route of entry actually occurs, where the bacteria enters through the mouth or throat. And on the right, you see what actually happens to the meninges after infection. As you can see that there's swelling, fluid production, and pressure exerted onto the brain. How do I know I got meningitis? So there are various symptoms that you must keep in mind as you go to Earth. The first is a fever and sore throat. From here, if disease progresses, it can lead to coma and seizures. These are often due to increased intracranial pressure because of the swelling of the meninges and fluid present. And then last, you have encephalopathy, which is the swelling of the brain and can ultimately lead to brain damage and death. So who is affected on Earth? The rate of disease is highest in very young children, under 1 year old. And again, the prevalence peaks in the teens from the ages of 16 to around 23 years old. Keep this in mind as you come in contact with various Earthlings while conquering Earth. And who is affected again? Which area of Earth is affected? This meningitis occurs worldwide, but it's most prevalent in something called the meningitis belt in the sub-Saharan Africa, indicated by the dark blue on this graph. You can see here that there is a large portion of sub-Saharan Africa that is prone to high epidemic outbreaks. Keep this in mind again as you go towards Earth. And if you are located in these areas, stormtroopers, be aware. I will now pass it on to Taylor, who will explain to you how we actually detect meningitis and what will happen if you actually are diagnosed and have this disease.
So troopers, you're probably wondering, how does it work? What's a lumbar puncture? Well, a lumbar puncture is a key investigation in which a thin hollow needle is placed in between the space between two bones and a fluid called cerebrospinal fluid is removed. This fluid is the fluid that surrounds both the brain and the spinal cord. And up to 10 milliliters of this fluid can be taken safely. This test has also been called a spinal tap colloquially here on the Death Star. So you're asking, why should we remove that fluid? Well, if we test that fluid in conjunction with other tests such as blood tests, that will allow the physicians to confirm whether or not a patient has meningitis and what type of bacteria is causing that infection. So essentially, the cerebrospinal fluid will tell us what type of meningeal infection that the individual has. And as most people infected with meningitis will have a symptom called pleocytosis, which is a high concentration of cells, particularly white blood cells known as leukocytes, in their fluid. Pleocytosis is generally the cause of meningitis infection. However, around 1 to 2% of the population are infected without showing signs of this symptom known as pleocytosis. So I talked about a cell count. What is that exactly? Well, determining the cerebrospinal fluid white blood cell count can also confirm infection, as more than 90% of the adult population with bacterial meningitis have had counts of greater than 100 cells per microliter. Again, the absence of pleocytosis does not mean that a person is not afflicted, as there are cases in which children, those who have been treated with antibiotics, and those who are immunocompromised often do not have pleocytosis, but have been shown to have been infected with bacterial meningitis. So this brings us to cerebrospinal fluid leukocyte differential. So the leukocytes, as I mentioned, which are essentially white blood cells, the differential is useful in helping to predict what type of pathogen is causing the infection. So if the cerebrospinal fluid contains primarily a lymphocytic, which is essentially a small leukocyte, dominance, this would suggest that the individual that is afflicted has been afflicted with a viral infection. Oppositely, if there is a neutrophilic dominance, which is a bacterial white blood cell, this suggests that a bacterial infection is at play. There are exceptions to the rule, as cerebrospinal fluid neutrophil dominance has also been seen with other types of meningitis, mostly related to tuberculosis. As we can see in the table on the left here, tuberculosis does carry the same exact traits as those seen in both viral and fungal infections. So, how do we figure out what's causing this? Well, cerebrospinal fluid is used with a microscopy technique known as gram staining. This helps doctors to determine which bacteria is causing the infection. It's a reliable test with a roughly 50 to 99% sensitivity, depending upon the amount of cerebrospinal fluid that is taken from the patient. With gram staining, when the cerebrospinal fluid is gram stained, we have gone through a process known as culturing. This allows the bacteria that is present to be seen in those affected with bacterial meningitis. This test is often used because it diagnoses between 70 to up to 85% of cases prior to the patients being exposed to antibiotics. When a patient is exposed to an antibiotic, the sensitivity ultimately drops by about 20% following antibiotic treatment. Therefore, it is very important for lumbar punctures to be utilized as soon as possible for the maximum benefits and correct diagnoses, as there can be sterilization due to antibiotic usage. So, to prepare for Earth, here are some quick facts regarding the procedure. Earthlings use money as a form of currency, not like here. And the price between these spinal taps can range between $400 and $4,000 in US dollars, depending. And it often depends on which place you live in. Tests are often covered by something that they call health insurance. They are the most reliable and definite procedure for diagnosing meningitis, as aforementioned. Okay, troopers, you've learned all that you need to know regarding this process. Our ability to conquer Earth is going to depend upon your ability to take this information and remember it well. Good luck, troopers.